I'm Dr. Nichelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place to get evidence-based information about your reproductive mental health.
Meaning mental health in relation to reproductive hormone changes like pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today we're going to talk about a really difficult, delicate topic. We're going to talk about postpartum psychosis.
And how to know if you might have it or not.
Okay, so maybe we could talk about how common it is. How common is it?
Yeah, so it's actually not common. It's pretty rare. It only happens with an incidence of about 1 or 2 in 1,000 childbirths.
Less than 1%, right?
Right.
So who is at risk for postpartum psychosis?
Obviously, if you've had a previous history of postpartum psychosis, that's when you're at greatest risk for it. But it's also people with a personal history of bipolar disorder or a family history of bipolar disorder. But even then, it's like 50% of people who experience postpartum psychosis, so half of people who get postpartum psychosis, have never had any kind of psychiatric history before.
But I would say probably the vast majority of people go on to be diagnosed and develop bipolar disorder that needs treatment long term.
Right, so most people with postpartum psychosis then end up with a diagnosis of bipolar disorder. But there are a few people who have postpartum psychosis and then never have any kind of psychiatric disorder outside of the postpartum period. So it usually shows up around 2 to 4 weeks postpartum, but it can show up, anytime in those first few months postpartum. If it shows up later in the postpartum period, it's still postpartum psychosis, but it's likely caused by like a mood disorder or some other underlying disorder that hasn't been treated. So in actual postpartum psychosis, showing up around 2 to 4 weeks, and the more common symptoms that first occur are feeling really irritable or having like big mood swings and mood changes, and not being able to sleep when the baby's sleeping or feeling like you don't need any sleep.
Also racing thoughts where it just like feels like everything's kind of jumbled up, erratic behavior to kind of match that thought pattern.
Really disorganized or maybe confusing thoughts. And all these things kind of get worse, right, as time progresses. So maybe in the first few days it's just irritability and not really sleeping, but then kind of the other symptoms start showing up.
Delusions? What does that look like?
So delusions are by definition fixed false beliefs. The person actually thinks this is 100% true, this belief that they have, when in reality it's not at all true.
The hard part about postpartum psychosis is that it might, be there, and then they might have a period where they're doing a little bit better and then be there again. So kind of a waxing and waning presentation. The difficult part for us as psychiatrists is that we may see them in a period of time where they're like doing well, and the reality is that they're really irritable and they've been having postpartum psychosis in times where we're not actually seeing them.
Yeah.
That's one of the things that's so difficult about it, is that during periods of lucidity or periods where you're doing well, some of the thoughts that you have, like the delusional thoughts, might feel like maybe, I don't know. Yeah. They may not be so fixed while you're doing well.
Most of the delusions are around the baby too. So like, my baby is
not my baby.
Not my baby, oh yeah, or my baby is Jesus, or some sort of like Messiah or God.
Religious stuff comes up a lot.
Oh yeah, a lot of religious tones. And then they can also have hallucinations.
I think auditory hallucinations are more common than visual hallucinations, meaning auditory meaning you might hear things. They might be messages from the TV, or they might be, just hearing whispers, talks, hearing like kind of noise sort of things.
Voices that other people can't hear. So those are really common in postpartum psychosis too. And then visual hallucinations, which like Dr. Haynes said, is not very common.
It's really important not to confuse delusional thoughts or disorganized thoughts with intrusive thoughts.
very important. So intrusive thoughts are thoughts that just kind of pop into your head, or images that just pop into your head that you can't really control. They're unwanted thoughts. And a lot of times when people are experiencing these, they worry that they have postpartum psychosis or they're going crazy, is what I hear a lot.
When I have someone with intrusive thoughts that are becoming problematic, they are so bothered by them.
Yes.
So bothered. I mean, like
So
tears when we're talking
distressed.
about, like, just they are not comfortable with the thoughts. They are not congruent, or they do not match what they actually want to do.
Well, and so that's an important piece to add in, is that a lot of times these intrusive thoughts are thoughts like of harming your baby. Like, I won't put a thought out there, but just that you're the one causing the harm to your baby, or something disturbing is happening to your baby, but you don't really want that to happen. It's not congruent with what you want. It's more kind of your mind thinking up all the possible ways that your baby might be harmed, which is different
Then I want to harm my baby.
than I think I need to harm my baby to save them from
XYZ.
the devil or something.
Anything. The vast majority of people in the postpartum period, and I would just say people in general, have intrusive thoughts. It's more about how bothersome they are. And I kind of think of intrusive thoughts more of like the what if. What if I'm doing this and accidentally harm my baby? Or what if I did this and harmed my baby? It's not I should, or this matches what's going on with my thought process. The what if, for me, is like an evolutionary protective mechanism that kind of goes awry to protect baby, that you don't do those things. So if you're doing things to prevent yourself from falling while you're carrying your baby or something like that, that's probably not postpartum psychosis. I mean, we can't say 100%, right? But it's really distressing and you try to keep it from happening.
Right.
Yeah.
So that's kind of the big difference, right, between postpartum psychosis, where oftentimes baby can be at risk of being harmed, or mom can be at risk of harming herself, but it's congruent with kind of these delusions or hallucinations or disorganized thinking that's going on at the moment, versus intrusive thoughts are very incongruent with what you really want to happen. It's more kind of this anxiety response. And most of the time, people with postpartum psychosis actually aren't concerned that they have postpartum psychosis, right? They're in a different reality. And then people who are having intrusive thoughts are more concerned, like, am I having postpartum psychosis and going crazy?
And just hearing like, oh, the intrusive thoughts occur for a lot of people. They're more reflective of anxiety. We feel comfortable that, like, because you're actively trying to prevent them, everything's likely okay, can be like so relieving for a lot of people.
Yeah, for sure. But it's important to go to the right provider to talk with them about the thoughts that you're having, because it's not uncommon that providers who aren't really well trained in postpartum mental illness can also confuse the two. So you might come to them saying, I'm having these really scary thoughts of harming my child, and they might report you to CPS because they don't really understand that, oh, there's this difference between the two. And the person who's having these intrusive thoughts of harming their child is actually at no risk of harming their child, versus the person who is having psychosis is at risk of harming their child.
I have had patients who are experiencing intrusive thoughts, really bothered by them, very clear to someone who is trained, who have been involuntarily admitted to the psychiatric hospital.
Oh, yeah.
And that's like not cool. Because anxiety, everyone's safe, but it's really about the bigger picture and what else is going on, the irritability, the racing thoughts, the waxing and waning presentation, all of that together is a psychiatric emergency. I think that's very